Hello friends, and welcome to the Research Hub, where we research and we discuss topics that may well be affecting your health and well-being. So let's dive in. This is what the government have to say. There's the largest ever national pandemic response exercise to strengthen against future threats. So they've looked at the COVID inquiry, and the COVID inquiry was mandated, basically, that something needed to be done in case of a future threat, a future problem. But what they did was they actually looked back at our pandemic response right from the very beginning. So there's an inquiry that's been going on. The government's pandemic planning has been stepped up in response to the COVID-19 inquiry, Module 1. Okay, so Parliament, I'll bring us back to that. I want to show you the modules first. So this is the UK COVID-19 inquiry website, and it's a public inquiry, and they've got, for us, and I have shared the audio, so it should be fine. They've got a very brief summary of Module 1 and what Module 1 looked at. So I want you to follow along with me, and we'll see what they have to say.
This video will cover the structure of the UK COVID-19 inquiry, the findings from its first module, and the recommendations made by the chair, Baroness Heather Hallett. The UK COVID-19 inquiry is an independent public inquiry examining the response to and impact of the COVID-19 pandemic to learn lessons for the future. The scale of the pandemic was unprecedented. The inquiry has a huge range of
The scale of the pandemic was unprecedented.
Issues to cover. The chair of the inquiry, Baroness Hallett, decided to address this challenge by dividing its work into separate investigations known as modules. Each module is focused on a different topic with its own public hearings where the chair hears evidence.
You got to love a graphic. Oh, they don't. Oh, it's a shame. They don't keep it on. I love a graphic.
Following hearings, recommendations for changes are developed and put into a module report. These reports will contain findings from the evidence collected across each module and the chair's recommendations for the future. The first module, Module 1, focuses on the resilience and preparedness of the United Kingdom. The investigation examined the state of the UK structures and the procedures in place to prepare for and respond to a pandemic.
Now,
Future reports will focus on specific areas including core UK decision-making and political governance, including Scotland, Wales and Northern Ireland. Healthcare system.
Well, I can say from the get-go, if they looked at, they've looked back at the whole pandemic period and looked at what government did. So the interesting thing about this, the discussions around the COVID inquiry this week, has been how the ones that I've heard have come from various different places, and it's been how the facts and the figures that they've been given, the numbers, all the numbers that they've been given, and therefore the numbers they've generated, those are all false, really, because nobody really knows the numbers, because so many deaths. And I'll go into this with you, because I will go into it with you now. So just as a graphic, these are the deaths, the amount of deaths. And it's 1953 to 2019. Okay? Oh, no, it's not 2019. I think it goes on even further. Oh, no, it doesn't. 2021, I think it goes on to. Oh, 2020. So that is the rate of deaths from 1953 to 2020. Okay. Between 1953 and 2021, the death rate of the United Kingdom fluctuated between a high of 12.2 deaths per thousand in 1962 and a low of 8.7 in 2011. From 2011 onwards, the death rate creeped up slightly and in 2020 reached 10.3 deaths per thousand people. So still less than 1953. The most recent year provided here, the death rate was 10, a decline from 2020, but still slightly higher than in almost every year in the 21st century. So that's the 21st century, but look at the 20th century. Look how high they were in the 20th century. The first period was weeks 13 and 22 of 2020, which saw 2 weeks in late April report more than 20,000 deaths. Excess deaths for the week ending April 17th, 2020 were 11,854 and 11,539 for the following week. Another wave of deaths occurred in January 2021, when there were more than 18,000 deaths per week between weeks 3 and 5 of that year. So between 20 and 22, life expectancy in the UK was approximately 82 and a half for women and 78 and a half for men. Compared with life expectancy in the 80s, that marked an increase in around 6 years for women and almost 8 years for men. But improvements have been slowing in recent years and have even declined since 2017. As of 2023, so that's when this would have been done, the country with the highest life expectancy in the world was Switzerland, followed by Japan, and then by Spain. So if you were born and bred in Switzerland, your average age life expectancy is 84 and a bit. So yeah, so I just thought I'd use that graphic to show you the deaths over time. And then we have this graphic, and we look at the leading causes of death in the UK from 2001 to 2018 by group. So interesting. These were the diseases we were dying from. So we've got cerebrovascular diseases. So that's brain, dementia and Alzheimer's, ischemic heart diseases in green. So that's your heart. Chronic lower respiratory diseases. So these are issues with lung disease, influenza and pneumonia. So that's all your categories for your flus. And then malignant neoplasm of trachea, bronchus and lung. Interesting, it's got its own category. Must be quite a high one. Well, it is reasonably high. Not as high as ischemic heart disease, which is obviously the largest. So we're suffering with heart disease. This is something that we really need to take note of. But the thing that I was more interested in was the influenza and the pneumonia, which is this line here. Oh, I've taken it out. There we are. So if we take all of these out and just look at that over time. So from 2003 was the highest number of deaths. So this is colds and flu. But when you put everything else back in, it makes a much prettier graph. So you can find that if you want to at the statistics website, Statista. And it's interesting because you can find all manner of information on Statista. But, hang on, where is it? I actually asked Copilot earlier when I was preparing for this, and that's how I got to Statista, about the deaths over time between 2015 and 2025. I wanted to know about the death rate, so I asked, show me UK death statistics from 2015 to 2025. So it gave me them, and it gave me them. I didn't mention COVID. I didn't say anything about COVID, and this might just be Copilot. I should check it in Claude, actually. But 2015, first thing it says, typical pre-pandemic mortality. I didn't ask it about the pandemic. 2016, slight decline. 2017, winter flu impact. So we had a big impact. So you got 607,000 deaths because there was a high winter flu impact. I wonder if that's because they've upped the amount of flu injections that you can have now. And I'm sure it's Dr. Campbell, who's on YouTube, who will give you some really interesting information about the use of flu vaccines and your increased susceptibility to getting flu. There's a correlation. So yeah, interesting. 2018, higher winter mortality. So that may well be the year where they started putting the energy prices up, and the fact that so many older people died because they couldn't afford to put food in the house or put heating on the meters. Maybe. Who knows? 2018, higher winter mortality. We've just done that one. 2019, stable year before pandemic. So with the pandemic's back, like we didn't know anything about the pandemic in 2019. So yeah, before the pandemic. 2020, highest since 1918. Now I showed you that graph. It doesn't have the numbers, death numbers for 2021 up. I'll see if I can research it and find it, because it will be interesting to correlate and look at that in a graph and see how high it went compared to the statistics we saw on the graph where they were really high in like the 1960s. Okay, 2021, what do you know? Decline in deaths, and they've put decline after vaccine rollout. I would just go so far as to say that we won't know the deaths associated to the vaccine rollout for a little while, because it's only now coming to light the amount of deaths that have happened post-vaccination. And the data, still trying to find out. 2022, still elevated compared to pre-pandemic. So, yeah. In 2023, a slight increase. And in 2024, 2.2% fewer than 2023. So at the moment, where our death rates are dropping. So that was the Office for National Statistics, and Copilot very kindly put it into a nice little chart for me. So I then said, plot these statistics on a graph showing all causes of death. And he gave me this graph, which is not great because it doesn't break it down. It just says all cause death. So I was like, right, that's no good. So I then said, I would like the graph to show cause of death for each year. So it then came and gave me all the different figures for each year and still left other causes in. So by this time, I was getting a little bit cheesed off with Copilot. I can generate a stacked area chart, it says. I was like, no, please show me the chart again, giving me a breakdown of other causes as well. So I come can't work out if that was the... Oh no, it then gave me a block chart, and other causes was just in a block chart. So I then had to clarify again and say, look, I want them to be plotted onto the chart. And it finally came up with this. So UK deaths by cause. So this blue line here is the cardiovascular. This line here is the cancer. This line here is respiratory. So that's all those, oh, battery's running low. Can't have that. Hang on. Cool. Sorry, computer. All those where flus and things like that. Then we have COVID. So the deaths attributed to COVID is this purple chunk here. And you can see how, according to them, after the vaccinations, all the amounts have come down. I would argue that we've stopped calling flu COVID. So this has stayed reasonably steady, and this is coming down to probably just disappear into this respiratory place. So then we have accidents. Oh, what else do we have? Oh, dementia. So that's one of the leading causes. Not as bad as some, but dementia is another leading cause of death because, of course, our population is getting much older, or living much longer, should I say, rather than, but then the death statistics say that we're actually coming down a bit. So I don't know, maybe not. Accidents, we've got diabetes, liver, and other. So the other is a really big chunk, but that's fine. But it broke it down a little bit more for me. So I was interested in that. And what it reveals says miscellaneous causes fluctuate, especially during the pandemic years when COVID dominated. Oh dear. So it says breaking down other causes highlights the growing burden of dementia, reflecting on an aging population, the persistent impact of lifestyle-related conditions like diabetes and liver disease, big issues. The stability of external causes, accidents, which remain significant but less variable. I would argue that probably takes up a massive amount. Think about the stability of external causes. So your environment, it says accidents. What accidents? Like we got locked up in our houses for a period of time, and we've actually worked out that was an accident, that kind of accident. I wonder, it doesn't cover suicide, but it does make me wonder how that would kind of come into this. So when they're talking about the, getting back to our original bit, when we're talking about the COVID inquiry, and we were looking at governance,
vaccines and therapeutics, procurement and distribution of key equipment and supplies,
procurement of supplies, procurement of supplies. Okay. Yeah, we won't go there.
the care sector, test, trace and isolate programs, children and young people, and the economic response to the pandemic. Module 1. The resilience and preparedness of the United Kingdom. Politicians have to make tough decisions about how to use resources to prepare for emergencies. Preparing for a pandemic or any other emergency costs money, even if it is an event that might not happen. However, the UK COVID-19 inquiry has found that the system of building preparedness for the pandemic, that is, our ability to deal with the pandemic, suffered from several significant flaws. Despite planning for an influenza, also known as flu, outbreak, our preparedness and resilience was not adequate for the global pandemic that occurred. Emergency planning was complicated by the many institutions and structures.
No organisation, lack of organisation across all levels
is involved. The approach to risk assessment was flawed, resulting in inadequate planning to manage and prevent risks and respond to them effectively. The UK government's outdated pandemic strategy, developed in 2011, was not flexible enough to adapt when faced with the pandemic in 2020. Emergency planning failed to put enough consideration into existing health and social inequalities, and local authorities and volunteers were not adequately engaged.
And the doctors that spoke out about the whole debacle were not adequately engaged.
There was a failure to fully learn from past civil emergency exercises and outbreaks of disease.
Failure to learn. This is our government. Like, throughout our whole history, when you look at the way we have handled ourselves on a global stage, you would think they would be TICs taken into consideration. But no.
There was a lack of attention to the systems that would help test, trace and isolate. Policy documents were outdated, involved complicated rules and procedures which can cause long delays.
So why are these things not constantly monitored? Like, it has me asking the question instantly, what do they do? If all of our policies and procedures are outdated at a government level, why are you in position? Surely that's your job. Oh.
Full of jargon and were overly complex. Ministers, who are often without specialised training in civil contingencies, did not receive a broad enough range of scientific advice and often failed to challenge the advice they did get.
Yes. It's like, I don't care what you say, I'm going to do what I want.
Advisors lacked freedom and autonomy to express differing opinions, which led to a lack of diverse perspectives. Their advice was often undermined by groupthink, a phenomenon by which people in a group tend to think about the same things in the same way.
I would say that's our government. I would say that's the whole world in governance terms. I mean, all this having one global community, that agenda is under the auspices of groupthink. Like, I think that this inquiry is basically trying to tell us that, as the mere peasants in the street, that this is a problem for us. It's not a problem for us. Everything they're mentioning, I think the argument is they're slapping it in the faces of our governance. It's like the groupthink is in government. They did not want to, and effectively silenced voices. I did a YouTube video talking about how interesting it was that, you know, when you look at the death rates or the issues of death with COVID, and then look at the respiratory rates, and this was back in 2020 when I was trying to just calm people down over YouTube. I basically said that, you know, that it doesn't tally. It doesn't tally. And when they brought out the vaccine, I sat and went, hang on a minute. To have brought out a vaccine that quick, one of two things has happened. Either you knew about the pandemic about 7 years before it occurred, because that's roughly how long testing would take to bring a product to market at a public level, or that vaccine isn't tested. So I'm out, because either way, you're corrupt or you're corrupt. So I'm out. I didn't get the vaccine at all. I have not been vaccinated, I'm proud to say. So those two conscious connections effectively was groupthink. Everything was groupthink. And the groupthink is, how can we make money and keep other people suppressed? A friend of mine and I sat and said that what we thought was happening with all these like regulations over the lockdown at the time was there was a little man sitting in an office somewhere, and this is probably close to the truth, going, what can we get him to do next? What can we get him to agree to next? And I'm sure at a global stage, that's what's happening. What can we get them to be fearful of next? How can we keep them subservient to be able to do all the jobs that keep us in the places and the positions that we're quite happy to be in? So this was a way to keep people subservient.
If we had been better prepared, we could have avoided some of the massive financial, economic and human cost of the COVID-19 pandemic.
We being the government. If we had been a little more prepared.
The Inquiry's Module 1 report therefore recommends a major overhaul of how the UK government and devolved administrations in Northern Ireland, Scotland and Wales prepare for whole system civil emergencies. A comprehensive description of the recommendations can be found in the Module 1 report. A summary of these are: a radical simplification of the civil emergency preparedness and resilience systems. This includes rationalising and streamlining the current bureaucracy and providing better and simpler ministerial and official structures and leadership.
We need better leadership.
New approach to risk assessment that provides for a better and more comprehensive evaluation of a wider range of actual risks.
Actual risks. You know, the actual risks, not the contrived, there's actually no risk.
A new UK-wide approach to the development of strategy which learns lessons from the past and from regular civil emergency exercises and takes proper account of existing inequalities and vulnerabilities. Better systems of data collection and sharing in advance of future pandemics, and the commissioning of a wider range of research projects.
Yeah, we need a wider range of research projects. Do you know, I cannot find, and I'm still researching it, I'm still looking, I cannot find any information into spike protein that remains in the system post-vaccination and any problems with donated blood. There are no studies for it. So if a person who's been vaccinated donates blood in this country, and I'm a person who hasn't been vaccinated, as I've already explained, if I needed a blood transfusion, if I needed some form of infusion, I can refuse vaccinated blood. However, the vaccinated blood is not screened for the spike protein, and my research so far on the subject, because it's a subject that's really quite close to my heart, so my research on the subject has kind of taken me down oh, pardon me, hang on, let me just get a slurp. Taking me down the route of how long a spike protein has been recorded to be in somebody's system post-vaccination. And so far it's I found research that says that the spike protein shows up 2 years after, up to 2 years after. But there is still no information about any issues with donated vaccinated blood to somebody who's not been vaccinated, whether that spike protein goes into the unvaccinated person. I'll come back to you on it because it's a big subject that is going to take me a little bit longer to kind of get to grips with, but it falls into that.
Holding a UK-wide pandemic response exercise at least every 3 years and publishing the outcome. Bringing in
Right. Let me just...
expertise.
I can't... It won't allow me to go back.
From outside government and 3 years and publishing the outcome. bringing in external expertise from outside government and the civil service to challenge and guard against the known problems of groupthink. Publication of regular reports on the system of civil emergency preparedness and resilience. Lastly, and most importantly, the creation of a single independent statutory body responsible for whole system preparedness and response. It will consult widely, for example, with experts in the field of preparedness and resilience and the voluntary community and social sector, and provide
So they're actually bringing in the community sectors into their preparedness, which makes a massive difference, because the more people feel connected, the better it is in a kind of coming to grips with anything that could be flying down the pipe at us from the government.
Strategic advice to government and make recommendations. These recommendations are designed to be implemented and work together to produce real change in how the UK prepares for emergencies like pandemics. The Chair expects that all recommendations are acted upon and implemented within the timeframes set out in the recommendations. The inquiry will be monitoring the implementation of the recommendations during its lifetime. To find out more, or to download a copy of the full Module 1 report or other accessible format, visit the reports page on the UK COVID-19 Inquiry website.
There you go. So that was the first part of the inquiry, and it's an interesting the COVID inquiry is interesting because there's part 2 as well, and I'm just checking how long we've been on stream, because we've been on stream for an hour. I was going to go through part 2 because part 2 is really interesting, but I'm just going to draw your attention to just a couple of bits. Hang on. On part 1 that have been put into place. Let me just get it up. Okay. In response to Module 1, the Parliamentary Under-Secretary of State for Health and Social Care, I am today confirming that on the 18th of September, Exercise Pegasus, the National Tier 1 Pandemic Preparedness Exercise, is set to assess the UK's ability to respond to a pandemic. So that will commence from the 18th of September this year. So the exercise is due to take place from September to November, led by the Department of Health and Social Care and delivering with the UK Health Security Agency. Core exercise days have been confirmed for the 18th of September, the 9th of October and the 30th of October. Simulating the first phase of pandemic emergence, containment and mitigation. A fourth phase, recovery, is also planned for 2026. The UK government have committed to communicating the findings and lessons of the exercise as recommended by the COVID-19 inquiry, and a post-exercise report will be delivered in due course. So they've done it. Most of you probably didn't know about that. Some of you may well did, because the National Health Service have their involvement in all of this with this preparedness, because they're obviously a key player. They kind of expand out on what's being looked at. So we have the Pegasus objectives. Focused learning and improvement. This is the whole point from the government's point of view. This is in response to the inquiry, the government's point of view. While the exercise aims to simulate a realistic scenario, its objectives set specific elements where there is a reasonable prospect of useful learning, rather than assessing the totality of pandemic arrangements. And the 8 core objectives are Exercise decision-making processes for measures to contain, control, or mitigate the impact of a pandemic. Explore the impact of inequalities, their consideration within pandemic decision-making. This is significant inclusion, indicating a focus on equitable response. They're using all the right buzzwords. They're using all the right buzzwords. Don't really mean a lot, but effectively that's the explore the impact of inequalities, like between those people who are leaving the country because they've got to pay an extra 1,500 on their mansion, compared to somebody who is having to visit food banks each week because they're starving and are going home to a cold flat because they can't afford the heating. Those kind of inequalities, I think. So, investigate likely impacts of HMG decisions on the health and care system, His Majesty's government, and the impact that that would have on our healthcare system. That would have been nice before. That kind of thing you would expect. I expect it to be in place already. So, examine processes for the scaling up of relevant capabilities. Investigate the effectiveness of coordination, including the exchange of information between different tiers in a UK-wide response. So now we're getting to information and sharing of information. I wonder whether that encompasses voices that are against, that freedom of speech thing. Test the strategic response to disinformation and misinformation. There we have it, ladies and gentlemen. This highlights the importance of managing public information during a crisis. Now, that is part of the UK report, but the very first thing that popped into my head as soon as I saw that is the freedom of speech to be able to give information, and the fact that you cannot, or we couldn't give a response because my YouTube video about death rates was taken down. They effectively said that it was, you get disinformation, misinformation, and malinformation. So one is information that you didn't know wasn't true, but you shared it anyway. The other one is information that you knew was untrue and you shared it anyway. And the third one is information that is actually true, but doesn't fit the current narrative of the global governance. So that gets shut down. And there was a lot of that during COVID. So they're looking at that. So I'm going to try and put a really good spin on that and say that the strategic response to disinformation and misinformation is actually aimed at themselves. Because it would be really, really, really nice if we could highlight to them the importance of managing public information during a crisis. Like that disinformation and misinformation, it's not on our heads, mates. It's on your heads in government, because, yeah, the amount of strategic disinformation and misinformation that goes on from our government, yeah, we would really like to know the importance of managing that. So that's the National Health Service pulled to bits. I'm not pulling the National Health Service to bits. This is their website. You can find it on it's the briefing. So yeah, it's the IPMI Global. But yeah, that's what they're looking at when you break it all down. And the way they're actually putting it in, get this. As soon as I saw this headline, I was like, oh, good grief. School lockdown again in secret pandemic crisis. You're not going to believe this. Exclusive. Exercise Pegasus imagined a virus deadly to children. spreading around the world from an island in Southeast Asia. Just in case you forgot, that's Southeast Asia. China, the Philippines, South China, Malaysia, Cambodia. Oh, so yeah, that's it. Yeah, hang on, let me find my page. So yeah, island in Southeast Asia. So they chose there. Schools across the UK were locked down this autumn as part of a state drill to tackle the threat of a new deadly virus. Exercise Pegasus, which concluded last month and involved all major departments, was the biggest pandemic simulation exercise the country has ever seen. Those participating in the drill were told a novel enterovirus had broken out on a fictional island in Southeast Asia before spreading across the world. You couldn't make it up. They did. Unlike COVID-19, which disproportionately affected older age groups, the new virus was most lethal in the young. This is why they're putting preparedness into schools, because they're going to target the young next with their next virus. The virus is said to cause respiratory failure, brain swelling, and in rare cases, paralysis in infants, children, and teenagers. That's what they were told in the schools. Let me just go back to the headline. Schools locked down again in secret pandemic drill. That's the next pandemic. You heard it here first, folks. Okay. So, the spread of the imagined virus resulted in travel restrictions, school and business closures, and mask wearing in the UK and around the world. Ministers involved in the drill also had to war game, dealing with fictional street protests over social distancing. News of the drill comes a week after the second module of the COVID inquiry found that the UK did too little, too late to contain and mitigate COVID-19 in the early part of 2020. No shit, Shirley. Oh dear. Closing schools brought ordinary children to a halt, and the decision to shut them had a profound consequence on children, it said. Exercise Pegasus was designed a Tier 1 national emergency exercise, meaning it involved ministerial participation, all devolved nations, and activation of COBRA, the Cabinet Office briefing rooms, because they didn't bother with it, because why do it when we actually had the pandemic? Because they already knew it was coming. They knew how they were going to deal with it, and they were sitting there laughing at us while we did, like little soldiers, all the things we were supposed to do during the pandemic. It ran in 3 parts in September, October, and November this year, and imagined a novel version of the EVD68 had triggered a pandemic. So it's about the simulation. I had to bring that to you. That's the way that that's the government response to the COVID inquiry, saying this is what we need. I'm just going to remove that off the screen. Yeah, this is what we need from you as a government. We need you to sort yourselves out. We need you to stop being so bloody greedy. We need to stop giving you all your mates and big businesses that profit you handouts, especially during a pandemic when it comes to people's lives.